Let me help you as you prepare for your exam. Today we're going to be practicing some questions, your PHNP exam prep, Domain 1 Scientific Foundation. If you have not subscribed to my channel, subscribe to my channel on Royal Pearls Health and Wellness. Put on your notification button so that you will know when I drop my videos. You can visit my channel for some questions that we did in the past and some exam tips that we drop there. If you are preparing for your ANCC, you're preparing for English review, visit my channel and you will not regret it. So today we are going to be practicing these questions together today. This question is on scientific foundation. Pay attention, stay till the end of the question, and I know that you will get something that will help you today, and I wish you luck as you prepare your exam. So let's go. Number 1 says, a 45-year-old patient presents with slow movement, flat affect, and persistent sadness. The PHNP suspects low dopamine activity in the mesolimbic pathway. Which symptom is most associated with dopamine deficiency? So this question is asking about the sign of the dopamine deficiency in the mesolimbic pathway, and we have anhedonia, anxiety, hypervigilance, and flight of ideas. What do you think is the answer? We have anhedonia. This is because dopamine deficiency in mesolimbic pathway is linked to anhedonia. Anxiety and hypervigilance is linked to norepinephrine, while flight of ideas is linked to excess dopamine. So for your exam tip, remember that dopamine drives reward and pleasure. Number 2 says serotonin plays a critical role in mood regulation. Which neurotransmitter change is most associated with aggression and impulsivity? So this question wants to know the neurotransmitter that is implicated in aggression and impulsivity. We have high serotonin, low serotonin, high GABA, and low glutamate. What do you think? The answer here is low serotonin. This is because low serotonin is linked with impulsivity and aggression and suicidality. GABA is an inhibitory neurotransmitter, and glutamate is an excitatory neurotransmitter. For your exam tip, remember that low serotonin, low inhibition causes impulsivity and aggression. The next question says, which brain structure is primarily responsible for forming new memory and is often impaired early in Alzheimer's diseases? When you think about memory, which brain structure do you think about? We have hippocampus, we have amygdala, we have thalamus, and we have hypothalamus. What do you think? The answer here is hippocampus. Remember, hippocampus have to do with memory formation. Hippocampus have to do with memory formation. Amygdala regulate fears and emotions. Thalamus relates sensory input, and hypothalamus regulate hormones and hemostasis. Your exam tips here is hippocampus memory on campus, right? When we go to campus, we want to remember what we are taught in school. So hippocampus memory. A PHNP explained to a student that the hypothalamic pituitary adrenal axis is activated in stress. Which hormone is directly released from the adrenal gland? So this is stress. What hormone is related to stress? We have cortisol, we have ACTH, we have CRH, and we have oxytocin. What do you think? The answer is cortisol. Cortisol, stress. Hypothalamus releases CRH, pituitary releases ACTH, and adrenal gland releases cortisol. Oxytocin is not related to this, okay? So remember. Which neuroimaging technique measures changes in blood oxygen level to study brain activities during stress? task. We are talking about function here, right? So we have A, CT scan, B, function MRI, C, PET scan, and D, EEG. The answer is function MRI. And the rationale says that function MRI tracks oxygen changes, CT shows structure, PET shows metabolism, EEG shows electrical activities. Exam tip, fMRI, function, CT, structure. Remember this in your exam. A client with Parkinson's disease develops hallucination after increasing dopaminergic medication. Which brain pathway is overstimulated? When you talk about hallucination, where does that happen? We have nigrostriatal pathway, we have mesolimbic, we have mesocortical, and we have tuberoinfundibular. Remember that a hallucination is a positive symptom of schizophrenia. This answer is mesolimbic. So when there is too much dopamine in the mesolimbic pathway, that is what causes the positive symptom of schizophrenia, which includes psychosis, includes hallucination, delusion. Okay. So excess dopamine in mesolimbic pathway causes psychosis, causes hallucination. Nigrostriatal pathway, when you talk about that, you are talking about movement problem. Mesocortical pathway, that is where you have negative symptoms. And tuberoinfundibular pathway, that is where you have prolactin regulation. So your exam tip here is too much dopamine in mesolimbic pathway causes psychosis. All those symptoms that comes with psychosis. Okay. Which neurotransmitter imbalance is most associated with generalized anxiety disorder? We have excess dopamine, low GABA, high serotonin, and low acetylcholine. What do you think? We have low GABA. Remember that GABA is an inhibitory neurotransmitter. Low levels causes overactivation and anxiety problem. GABA helps you to chill, so when you do not have it, you become anxious. Dopamine and serotonin are not primarily drivers of generalized anxiety disorder. Acetylcholine is linked with cognition, memory. So remember during your exam that GABA is calm. GABA helps you to chill. So when you do not have GABA, when you have low GABA, you are anxious, you're not chilling. Okay. The PMHNP records that pharmacogenomics impacts antidepressant selection. Which enzyme metabolizes many SSRIs and TCAs? So we are looking at the enzyme that metabolizes majorly SSRIs and TCAs. And we have CYP3A4, we have CYP2D6, we have MAOA, and we have COMT. What do you think? So most of those SSRIs and TCAs are metabolized by they are CYP2D6 metabolizers. You need to remember this. You also need to remember the CYP2A1 like that. Okay. Rationale. CYP2D6 metabolizes SSRIs, TCAs, and CY3A4 also metabolizes many drugs but less relevant. MIO is a breakdown of monoamines, and COMT degrades dopamine. So remember that CYP2D6, they are key for antidepressants. You do not need to forget this. A patient with Huntington's disease shows irritability, chorea, and cognitive decline. Which neurotransmitter is most depleted? This patient is showing irritability, cognitive decline. Which neurotransmitter do you think is implicated in this? we have dopamine. We are looking at the neurotransmitter that is less, that is reduced. We have dopamine, we have GABA, serotonin, and glutamate. What do you think? B, the GABA. Remember, loss of GABA neurons causes excitatory imbalance, leading to chorea. Dopamine is excessive, not low, in this kind of people. And Huntington's, your exam tip is that Huntington is low GABA and high dopamine. Huntington is low GABA and high dopamine. That means if this person have low GABA, the person might also be having anxiety. Remember, which brain lobe is most responsible for executive function, impulse control, and decision making? Which brain lobe? We have temporal, occipital, frontal, and parietal. What do you think? Frontal lobe. Frontal lobe is the one that is responsible for executive function. Frontal lobe, executive function. Temporal lobe has a memory and auditory. Occipital is vision, remember. Parietal is sensory processing. So your exam tip, frontal lobe, functions and future planning. Frontal, they are always in the front, they are planning, they are the one leading executive function. Okay? A 23-year-old presents with new onset of schizophrenia. Positive symptoms like hallucination are best explained by which pathway? Which pathway abnormality? We have also said this during this process. When somebody is having positive symptoms like hallucination, which pathway is affected? We have mesolimbic dopamine excess, mesocortical dopamine deficit, nigrostriatal dopamine excess, tuberoinfundibular dopamine deficit. You know, this kind of question can confuse you and you need to pay attention. These are the things that you need to be paying attention as you are studying. You see how they match them. If you do not know whether it is low or excess, that will become another confusion. So let's look at the answer. Say mesolimbic dopamine excess. Remember that it's excess dopamine in the mesolimbic pathway that is always causing the positive symptoms like hallucination, delusion, psychosis. All right. Let's see the positive symptoms, mesolimbic dopamine excess. Negative symptoms, mesocortical dopamine deficit. Exam tip, remember that positive mesolimbic, negative mesocortical. Remember that negative, they have less in that mesocortical. In the mesolimbic, they have excess, and that is what is causing the positive symptoms. All right. Which neuroimaging test is best for ruling out brain tumors in psychiatric presentation? We have A, CT scan, B, EEG, C, fMRI, and D, SPECT. CT scan. Like we said, CT is fast and best for ruling out structural lesions. EEG is electrical, fMRI is functional, remember, and SPCT is for perfusion. So always rule out organic causes first. All right. Which neurotransmitter is primarily involved in the regulation of sleep and wake cycle? We have acetylcholine, histamine, melatonin, and norepinephrine. What do you think? Which neurotransmitter? We have melatonin. Remember, melatonin, sleep. Melatonin from pineal gland regulates sleep, wake, and histamine keeps awake. Acetylcholine is for REM, norepinephrine for arousal. Remember, melatonin is a sleep hormone. You need to remember this. The PHNP explained that norepinephrine is synthesized from which precursor? We have tryptophan, triazine, glutamate, and glycine. What do you think? We have tyrosine. Tyrosine is the LDOP. So I don't really like think about so much about this kind of questions, but it's also good to know. You can read up on this if you do not understand it. But remember that tyrosine, dopamine, and norepinephrine. Okay. Which genetic variation is associated with poor metabolism of antidepressant and risk of toxicity? Which genetic variation? So we have CYP2D6, ultra rapid metabolizer. We have CYP2D6, poor metabolizer. We have COMT, high activity, and we have MAOA, deletion. What do you think? We have CYP2D, poor metabolizer. Remember what we said before, that most of the antidepressants are metabolized by CYP2D. So if someone is poor metabolizer, that person is at risk for toxicity. Look, let's see what the rationale says. Say more poor metabolizers accumulate drug. Side effects and toxicities is possible. And then ultra rapid metabolizers, they clear the drug too fast. So exam tips, you have to know CYP2Ds and phenotypes for psych medication. You need to know that poor metabolizers, I would say just know that poor metabolizers, they accumulate the drug in their system and they can have toxicity. Fast metabolizers, they remove the drug fast. It's just like the inhibitors and the inducers, right? Which brain region is hyperactive in patients with obsessive compulsive disorder? When somebody have OCD, which brain is hyperactive? We have prefrontal cortex. We have orbitofrontal cortex. We have hippocampus, and we have cerebellum. What do you think? That is the orbitofrontal cortex. And the rationale says that orbitofrontal cortex hyperactivity is linked with intrusive thoughts and compulsion. So exam tip, remember OCD, orbitofrontal overdrive. All right, the overactivity that is associated with OCD is as a result of orbitofrontal cortex hyperactivity. All right. Which structure regulates fear, conditioning, and emotional responses? We have A, amygdala, B, hippocampus, C, basal ganglia, and D, thalamus. What do you think? Is amygdala. Remember amygdala emotion. Amygdala is responsible for fears and emotions, okay? Amygdala, fear and aggression. Hippocampus, memory. Basal ganglia is movement, and thalamus is sensory relay. Exam tip, amygdala alarm system is fears. It has like emotions. Which neurotransmitter is most implicated in ADHD pathophysiology? You see, neurotransmitter is big on ANCC, so you need to know them. We have low dopamine and norepinephrine. We have high serotonin, high GABA, low acetylcholine. What do you think is implicated in ADHD? So the answer is low dopamine and norepinephrine. Look at the rationale. ADHD is linked to reduced dopamine and norepinephrine in prefrontal circuits. So you need to know this. It is linked to reduced dopamine and norepinephrine in the prefrontal cortex. Exam tip: ADHD is dopamine plus norepinephrine deficit. All right. Which sleep stage is most associated with memory consolidation? Which sleep stage is most associated with memory consolidation? We have stage 1, NREM. We have stage 2, we have REM sleep, and we have deep slow wave sleep. Which of these stages is associated with memory consolidation? Is REM sleep. I did a video on this too, so you can check my video on my channel, and let's look at the rationale. REM consolidates emotions, memory, and processing. Slow waves restores energy. Tips: REMs remember, REMs remember, REMs consolidates memory. Remember that, okay? The next question is, when brain chemical imbalance, which brain chemical imbalance is linked to symptoms of PTSD, such as hyperarousal and exaggerated startle response? We have low cortisol, high norepinephrine. We have high cortisol, low norepinephrine. We have low serotonin, high dopamine, high GABA, and low glutamate. What do you think is the answer? We have low cortisol and high norepinephrine. PTSD patients often show reduced cortisol feedback with high norepinephrine. Hyperarousal. That is what causes hyperarousal. Remember, your exam tip says low cortisol breaks, norepinephrine overdrives. Low cortisol break, norepinephrine overdrives. All right. And that was the last question. If you gained something in this, type helpful on the comment section and follow me. Share this to so many people that you know that are preparing for exam. Remember to share my link, remember to share my website so that they can subscribe, and I will see you in my next video. Good luck.